Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Waterlow scale assesses the risk of pressure ulcer development in patients. It evaluates multiple factors, including body mass index, skin type and integrity, mobility, nutritional status, continence, and special risk categories, such as diabetes or neurological deficits. The main purpose is to identify individuals at increased risk for pressure ulcers to implement preventative interventions promptly. This tool assists healthcare professionals in clinical decision-making and care planning to reduce morbidity associated with pressure injuries. The Waterlow scale is indicated primarily for adult patients at risk of developing pressure ulcers. It is most applicable in acute care settings, long-term care facilities, and community nursing environments. The scale assesses risk factors including mobility, nutritional status, skin condition, age, and continence. Patients with limited mobility, chronic illnesses, or acute medical conditions are most commonly evaluated with this tool. Its use guides clinicians in implementing preventative measures and allocating resources efficiently to reduce pressure ulcer incidence. The Waterlow scale consists of 15 items assessing risk factors related to pressure ulcer development. It includes categories such as build or weight for height, skin type and visual risk areas, sex and age, continence, mobility, appetite, and tissue malnutrition. Each item offers multiple choice responses with assigned scores reflecting severity or risk level. The clinician records the patient's status within each category, selecting the option that best describes the current condition. Scores for all items are summed to generate a total risk score. According to established reference values, a score of 10 or below indicates low risk. 11 to 14 suggests at-risk status requiring preventative measures, 15 to 19 represents high risk necessitating intensified management, and 20 or above indicates very high risk with urgent intervention needed. The scoring guides care planning by quantifying risk intensity and identifying specific areas for targeted prevention. This structured format enables consistent and objective risk assessment across clinical settings. The Waterlow scale demonstrates varying sensitivity and specificity depending on the clinical setting and study design. Sensitivity refers to the tool's ability to correctly identify patients who will develop pressure ulcers, while specificity indicates its ability to correctly identify those who will not. Reported sensitivity values for the Waterlow scale range from approximately 35% to 80%, indicating that it captures a moderate to high proportion of at-risk patients. Specificity values are generally lower, often between 45% and 70%, reflecting more false positive identifications. For example, a sensitivity of 55% means that out of 100 patients who will develop pressure ulcers, the scale correctly identifies 55 as at risk, while a specificity of 60% means that out of 100 patients who will not develop ulcers, 60 are correctly classified as low risk. This balance affects clinical decision-making, where higher sensitivity may help prevent missed cases, but at the cost of overestimating risk in some patients. The Waterlow scale, developed in 1974 by Judy Waterlow, was designed to provide a systematic method for assessing a patient's risk of developing pressure ulcers. Validation studies have demonstrated variable sensitivity and specificity. One early study by Waterlow and colleagues reported sensitivity values ranging from 75 to 85%, indicating the tool's relative effectiveness in identifying at-risk individuals. Subsequent research has reinforced these findings, with some studies suggesting the scale's predictive validity is enhanced when combined with clinical judgment. However, critiques have noted issues related to inter-rater reliability, with kappa values in certain investigations falling below 0.6, suggesting moderate agreement at best between different assessors. The scale's components, including parameters such as build, skin type, and continence, are grounded in clinical consensus and empirical observation, contributing to its continued use in healthcare settings. Although the Waterlow scale lacks the extensive psychometric evaluation found in more contemporary tools, its long-standing application and incorporation into pressure ulcer prevention protocols underscore its practical utility supported by decades of empirical evidence. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.